And when we look at risk factors, this is obesity as a risk factor, this is Australian stuff, and this is when we look at risk factors for the Australian adult population: unsafe sex, occupation, illicit drugs, high cholesterol, lack of fruit and vegetables, overweight and obesity, alcohol benefit, alcohol harm, hypertension, physical inactivity, and tobacco. And this has changed just recently. Tobacco's come down a bit. But if you add up physical inactivity, overweight and obesity, which they halved because they said it was in everything else, and lack of fruit and veg, proper nutrition, it's the biggest risk factor for the Australian population. It's interesting, in Australian women, the biggest individual risk factor, and I suspect it's probably becoming more common here, is physical inactivity for women. So obesity is central to all these diseases and is a disease itself. Now, what are the risks of obesity, or the complications, as we should be calling them now? Diabetes is the big one, heart disease, blood pressure. Arthritis is the second most costly one after diabetes. And cancer has moved from here to here in the last few years as a major risk, and we need to be involving the oncologists in our discussions. Infertility, and I talked about this yesterday, but it's something that really impresses me. In the IVF programs in Sydney, what is the average BMI of women? Have a guess. 30, we've got a 30, any increase? 45, oh yeah, we've got a few of those, but it's 32. 32. If they could lose 6 kilos, get their BMI to under 30, their fertility increases 15 times. It's much cheaper to lose 6 kilograms than to pay for one round of IVF. And you can see the rest there. And this is the sort of teaching slide you use. It shows that obesity has complications everywhere. And some of them you don't think about. They're cardiovascular, respiratory, metabolic, central nervous system, cancer, and inflammation. Right? So treating obesity will treat all these. Now, how about in ethnic Chinese? So this is a study from 148,545 individuals. And this is the relative risk of diabetes, blood pressure, dyslipidemia, and NASH against BMI. Less than 23, it's about 1 for all of them. At 23, it's about 2 for all of them. At 25, it's about 3 to 4 to all of them. And at 30, it's between 5 and 7.5 times. So you start much earlier. So that's why we chose the BMI of 23 has been suggested. But given all this and the numbers, we're talking of millions of people who require treatment for obesity in any country. Millions. So there needs to be a range of treatments which depend on the degree of overweight and obesity and the presence of complications. So we know that. Obesity is a disease, there's lots of it, we need to treat it. Do we treat it? Well, this is a British study, and I keep bringing it up. So this is, they weighed the people as they went in to see their general practice, and then they asked the people as they came out, did your doctor talk to you about obesity, your weight, whatever? And the line that you need to look at is the bottom line. This is in men, but the same for women. For those who had a BMI greater than 40, their weight wasn't mentioned to 60% of them. So as medical professionals, we're not bringing up obesity when we should. Same in children. So I just want to quickly go through obesity and this is a bit of a diversion. Interesting enough, if you look at epidemiology and weight loss, people in epidemiology, the people who lose weight or gain excessive weight of those with the highest mortality. Weight loss in epidemiology for years increased the risk of death, but there weren't trials of intentional weight loss because no one had got around to doing it. And then they did a trial, and interesting enough, there was a reduction, particularly in obesity-related cancers in women. And, you know, if you lost more than 9 kilos, there was a 25% reduction in mortality.